This multivitamin, mineral, and fatty acid product is designed to address vitamin deficiency before, during, and after pregnancy. It contains important building blocks for the body and helps maintain good health. In addition to vitamins and minerals, this product also includes iron and folic acid, which are crucial for women of childbearing age to prevent spinal cord defects in developing babies. It is important to maintain adequate levels of folic acid through diet or supplements. As for daily dosage, it is recommended to take 1 capsule daily, preferably with a meal. The best time to take this multivitamin is in the morning, as it can help provide energy throughout the day. It is recommended to take this medication by mouth, usually once or twice daily or as directed by your doctor. If you are taking the powder form, mix it in water before swallowing. If you are taking the delayed release form, do not crush or chew it. This medication is best taken on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water. If stomach upset occurs, you may take this medication with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication. It is important to take this medication regularly at the same times each day to get the most benefit from it. Some common side effects of Prenatal plus DHA 27 mg, 800 Mg, 250 mg, 200 mg capsule multivitamins include constipation, diarrhea, or upset stomach, which are usually temporary and may go away as your body gets used to the medication. Iron in the supplement may cause your stools to turn black, which is not harmful. It's important to note that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of potential side effects. While many people using this medication do not experience serious side effects, it's important to contact your doctor if you notice any easy bleeding or bruising. Serious allergic reactions to this drug are rare, but seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. Before starting this multivitamin, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients, fish, or soy/peanuts. This product may contain inactive ingredients that can cause allergic reactions, so it's best to discuss this with your pharmacist. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication is safe to take during pregnancy when used as directed. However, if you are breastfeeding, it's best to consult your doctor before using this product. It's important to be aware of potential drug interactions when taking Prenatal plus DHA 27 mg, 800 Mg, 250 mg, 200 mg capsule multivitamins. These interactions can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare providers. Some products that may interact with this medication include chloramphenicol, certain anti-seizure drugs, and methyldopa. Additionally, this product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of Prenatal plus DHA 27 mg, 800 Mg, 250 mg, 200 mg capsule multivitamins. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Remember, it's important not to start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose or experience serious symptoms like passing out or trouble breathing after taking Prenatal plus DHA 27 Mg-800 Mg-250 Mg-200 Mg capsule multivitamins, call 911 immediately. You can also contact your local poison control center for assistance. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to not share this medication with others. Your doctor may recommend lab and/or medical tests, such as complete blood count and vitamin B12 levels, while you are taking this product. Be sure to keep all medical and lab appointments and consult your doctor for more details. Some brands of prenatal vitamins may also contain additional ingredients like calcium, zinc, iodine, or docusate. If you have any questions about the ingredients in your specific brand, it's best to consult your doctor or pharmacist. Remember, this product is not a substitute for a proper diet. It's important to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take double the dose to make up for the missed one. It's important to store this medication at room temperature, away from light and moisture. Make sure to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.